today we are going to look at this presentation, and I am going to focus today on autism in Black communities discourse. What I am going to talk about here is that we want to raise awareness of autism on Black communities. We know that there's a lot of issues that are cultural, and some of these issues are not prevalent in other ethnic minorities. So this presentation is going to look at the Black communities and the impact of autism in their communities. So, what is autism? The American Psychological Association describes autism as a lifelong neurodevelopmental condition characterized by difficulties in social interaction, in addition to repetitive behaviors and restricted interests. So, what we would like to see at Black and Autistic, would like to see more research done to investigate the degree to which race and ethnicity influences implicit and explicit biases towards autism. Further study is needed to identify community-level barriers to timely evaluation and diagnosis of Black autistic children so that treatments can be delivered as early as possible. So, my drive here is to raise awareness in the Black communities at this point. The reason I'm talking of the Black communities is because research is showing that Black children, especially, they are disadvantaged. Black autistic children. The Black community's experiences need to be heard and understood. So this platform is inviting anyone. You don't have to be Black only, but anyone who can help us to get into the Black communities and to be able to raise autism awareness, to enable them to come forward and tell us their experiences. Black families with autistic children, they need to be well informed about available services and to know that early support and intervention are crucial to their children's well-being and general progress. I know that religion and cultural beliefs in Black communities play a role in delayed diagnosis and intervention. And delayed diagnosis and intervention, leads to more stigmatization, more discrimination, exclusion from school, and misdiagnosis of autism. So Black families need to embrace autism and celebrate diversity. And this comes, when you talk of neurodiversity, this is a movement which is saying we have to embrace autistic people because autistic people are just different. The way they think, the way they process information is just different from the non-autistic people. And if we manage to do that as a society, we are embracing all diversity and we are being inclusive. So the Black communities are marginalized simply because on one side, autism is stigmatized in the communities. They don't come forward for services. But again, on the other side, there's a need to work with these communities to remove prejudice and segregation towards marginalized Black autistic children in society. Ethnicity is a crucial determinant of health inequalities in the UK. This is a research done recently, and there is evidence that Black communities face more inadequate healthcare access, including autism services. And race bears on the way resources are made accessible. This is not overt, it's not clear, it's not public that you can see that race bears on the way resources are made accessible. But it happens in a subtle way, and institutions can have input determining its meaning. And there's always an imbalance of power expressed through access to resources. This is how marginalized communities struggle to get services. And also, the lack of bilingual or culturally competent medical and clinical autism professionals presents a challenge with autism assessment. Most of the professionals that do diagnosis for autism, that do assessment for autism, they are not from the Black or Asian ethnic minorities. So there's a language barrier there. And Black communities were born not trusting the healthcare system, but their experience of racism led to the lack of trust. And I would invite you to see my article I did write. It is on ResearchGate, called Institutional Racialization in Autism and Research Practice. I am arguing here that we do not have enough professors, enough doctors, enough clinical experts in autism who are from the Black and ethnic minority communities. So this needs to change. While excluding marginalized subgroups is a primary ethical concern, it is. Any marginalized subgroup which is excluded, it's an ethical concern. But it's actually a double concern when one is autistic and Black. So a history of systemic racism has led to a few Black researchers and academics working in sciences, and has contributed to health disparities among Black autistic people. And this research done by Jones and Mandel in 2020. And Broder and Finjet pointed out that traditional autism research has been tested mainly on white, high-income children and families. And again, I would like to say that most of the research, again, is mainly done by mostly middle-income white men. You don't get many women getting involved, either Black or white. So we need to change this to bring in more researchers from different ethnic backgrounds, with more gender balance on researchers, and also including the autistic people themselves, which is another presentation I'll do, why it is important to include autistic researchers when we talk of autism. And the Center for Disease Control and Prevention did amazing data research, and this is the statistics. This is where we are coming from when you talk that there's an imbalance between black children and white children when it comes to autism. Black autistic children are less likely to have a first evaluation by age 36 months than white autistic children. That is 40% versus 45%. Black children with IQ lower or equal to 70 had a later median age at autism diagnosis than white children with IQ less or equal to 70. 48 months versus 42 months. Black autistic children are more likely than white children to be classified as having an intellectual disability, 47% and 27% respectively. And the research again continues to say that, to show that the percentage of autistic children evaluated by age 36 months varied by race and ethnicity. And you can see it's the analysis of the ethnicity here. 45% among white children, 43% among Hispanic children, and 40% among black children. So children with intellectual disability are more likely to be evaluated early. And black children are still less likely than white children to be evaluated by age 36 months. Also, among children with intellectual disability, the median age at autism diagnosis is 6 months later for black than for white children. And all this research in front of me now, the latest from the Center for Disease Control and Prevention is 2018, and MANE is 2020. And you can see that there are a lot of issues going on here. It could be biased racism towards black children. Again, it could be, religious and cultural issues whereby black parents do not come forward. But let me explain that research at the moment shows that the number of children getting diagnosis and assessment is rising up, is going up, despite all this data anyway. But this is due to the fact that autism is being highlighted, is being discussed, is coming more and more, onto discussions and research on news than before. So, on average, white children received the Autism Spectrum Disorder diagnosis at 6.3 years of age, compared with 7.9 years for black children. White children entered the mental health system at an earlier age, 6 versus 7.1 years. And the CDC prevention report has constantly noted that more white children are identified with autism than black children. And again here, it simply could be because more white parents are aware, are conscious, know about the services on autism, are coming forward. So as a result, their children tend to have more diagnoses, whereas more black parents are staying behind in their communities because they fear the stigma that is attached to autism. They've got cultural beliefs which they think it does not need these services that are provided. So there are so many issues to look at here, because stigma, lack of access to healthcare services due to non-citizenship, low income, and non-English primary language are potential barriers to identification of autistic children. And again, we have to know that poverty levels are more prevalent in Black communities, making Black autistic children more socially deprived than other races. And that research from Fintes et al. And Kawa et al. Noted that there had been a dramatic rise in the number of autistic individuals diagnosed with autism in the last 2 decades. And prevalence estimates are currently 1 to 2% across the world. However, there are no published statistics on autism diagnosis by ethnicity. I am also still trying to find data that can, show me statistics that is based on ethnicity. There is no breakdown to show the amount of funding directed towards the autistic and their families from the Black communities. Whilst I know there's a lot of funding on autism, but then how much of that funding is being accessible to marginalized communities? This needs thorough research as well. So, what is the aim of Black and autistic? We hope to achieve our aims by creating opportunities to disseminate information and discuss ideas and concerns. All of these statistics I've discussed now, Black communities need to come out. We need to share platforms and raise ideas and concerns. We need to share information regarding services. We need to share the latest advances in diagnosis and interventions. To facilitate caregivers, workshops and groups, which is one thing I'm actually working on now, outreaching to Black communities, talk to them and raise awareness. And we need to facilitate collaborating links between autistic children, caregivers, medical professionals, education providers, and local authorities, and to provide useful online information about autism. And this is more important because it's always in English. So we need to have more languages with information online, more languages with information in the libraries, so that even parents who cannot read or write in English, they can access all this information. And we want to have more autistic coming forward from Black communities so that we can reflect and share their views. And we need to understand the different models of disability, which we need to share during the training, which I'm providing now to families, to organizations. The medical models of disability, the social models of disability, and to try to promote using the more friendly, more accommodating models. To understand that autism is a different way of thinking and that diversity must be celebrated. This is very, very important. We must celebrate our differences so that we are not different. On the other hand, we are different in every aspect. But if we embrace all those differences, that's neurodiversity in autism. We need to understand the consequences and effects of camouflaging and masking, especially on girls. Camouflaging and masking, they tend to hide, the autism characteristics and things that goes around autism, so that no one can know they're autistic. But if that is happening, it's not good for them, because mentally, psychologically, it's depressing, because they are trying not to be themselves. We need to understand that communication is a two-way system between autistic and non-autistic people, and the importance of empathy. And this reminds me, double empathy, where even non-autistic people you also need to talk to autistic people in a way that they understand you. We don't need, the non-autistic people do not have to sit back and say, the burden of communication is on the autistic. The burden of communication is both of us. We need to enable parents to focus on the strength rather than the difficulties their children who are autistic have, and to identify and to try to prevent barriers to full opportunities, equal participation in the community, and to facilitate programs and workshops for parents, caregivers, and families. Currently, I still get some families outreaching to me to talk about how to communicate with autistic, children, families, which is great. But we need to do that more and more. And we need to have a vibrant and informative online presence as well, as I said earlier, in different languages. And to establish a universally designed and autistic centers, in the country for Black autistic children and their families as well, where they can go, where they can understand what is happening, and the families can come in with them. They can sit, they can share, play games, learn certain things in universally designed and friendly environments. And to provide autism support, consultancy, we also need to keep doing this in the Black communities. And so finally, I would like to thank you for listening to this presentation I did today, which I am targeting to Black communities to come out, to share ideas, not to be scared of the stigma that is attached to autism, to be able to access services that are provided in the country so that your own autistic child will have a better, meaningful, fulfilling life. And for this, I would like to thank you for paying attention and sitting through today's presentation. Thank you very much.